Here is my student ID. So for this assignment, I decided to talk about the different treatments for juvenile offenders. Juveniles entering the criminal justice system can bring a number of serious problems with them, such as substance abuse, academic failure, emotional disturbance, physical health issues, family problems, and a history of physical or even sexual abuse. Girls make up nearly 1/3 of juvenile arrests, a high percentage of whom report some of emotional, physical, or sexual abuse. Arrest rates for drug-related crimes also remain high among juveniles. A recent report showed that estimated 2.1 million of juvenile arrests back in 2008, approximately about 10% of them were for drug abuse or underage drinking violations. Effectively addressing these problems require their gaining access to comprehensive assessments, treatments, case management, and support services appropriate for their age and developmental stage. Assessment is particularly important because not all adolescents who have used drugs need the actual treatment. For those who do, there are several points in the juvenile justice system where treatment has been integrated, including juvenile drug courts, community-based supervision, juvenile detention, and community reentry. Many people don't know, but family, they do play an important role in the recovery of the substance abuse juveniles. But this influence, it can either be positive or negative. Parental substance abuse or criminal involvement, physical or sexual abuse by family members, and lack of parental involvement or supervision are all risk factors for adolescent substance abuse and delinquent behavior. There are many different treatments that have been examined to consider the magnitude of the mean effect, the variance around those means, and the extent of agreement across the three different effect size estimates. These three treatments show the strongest and most consistent evidence of reducing and non-institutionalized serious offenders. Interpersonal skill training, which are based on 3 studies, individual counseling based on 8 studies, and then behavioral programs based on 7 studies. There are only a small number of studies for each type of treatment because these treatments have not been studied in reference to serious non-institutionalized offenders. Following these treatment types and effectiveness were multiple services and re-institution programs for juveniles on probation or on parole. The type of treatments that showed the clearest evidence and that they were not effective included challenge programs, early release from probation or parole programs, deterrence programs, and vocational programs. One group of treatment types, including employment-related programs, academic programs, and social casework, group counseling, and family counseling programs presented mixed or ambiguous evidence. This group showed inconsistent effective size estimates. Thus, the effective treatment of juvenile substance abusers often require a family-based treatment model that targets the family functioning and the increased involvement of family members. Effective adolescent treatment approaches in multi-systematic therapy, multi-dimensional family therapy, and functional family therapy. These interventions, they show that strengthening families and increasing juvenile substance abuse and delinquent behavior. On the other hand, their equated effective sizes were more than likely favorable. However, without understanding the variables contributing to these differences, it's difficult to know whether the effectiveness calculated for this group of treatments were due to the treatment or maybe to another variable. Overall, I do think that any treatment plan that is offered to help these offenders or used to help them progress on to the next level of being better than they were before they started, and that should be the goal for all of us. Not only just to the offenders or any people that we consider criminals, anything that we can do to better ourselves, we should try to do that each day, that we have presented to us. So these programs, I believe they're not only beneficial to offenders, but mainly probably anyone inside of the jail system that needs them to go on to the next level and to be the best thing that they can be. And that should be the goal for all of us, not only offenders, but everyone in each day life, to be the better you that you can be. And so any programs or anyone that can help you get to that next step, that's the best thing is possible, the best thing that is presented to us, and the best thing that we can do to get to the next step. And thank you for listening to my speech.